My name is Jill Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm talking with Katie Guerino, a physical therapist in our Rehabilitation Services Department. And today we're going to be discussing aquatic therapy. So Katie, thank you so much for joining me today.
Thank you for having me.
This is such an interesting topic. We've been doing this show for a while, and it's wonderful to have you here.
Well, thank you.
Yeah. So I know you're a physical therapist, so maybe talk a little bit about your background, because it's quite extensive.
Mm-hmm. So I was born and raised here in St. Albans, and I went to UVM and studied physical therapy. I graduated in 2002. And upon graduation, I worked at another outpatient orthopedic clinic for about 4.5 years, where I first started to get my hand in aquatic therapy. And then I came to NMC about a little over 10 years ago.
Wow. And
for the past 10 years, I've actually done part-time pediatric school-based PT and part-time aquatic PT. So last year, after doing lots of traveling throughout Franklin and Grand Island County, serving all those schools, which I absolutely loved, I was really ready to focus my practice in one area.
Okay.
And I knew the department was looking to improve our aquatic program, so I decided to end my school contracts at the end of the school year, and now I am full-time at the pool practicing aquatic therapy.
Yeah, that's terrific. It's amazing to think that pool therapy is full-time, so this is terrific. And so what type of special training do you have? Is there anything special you need to do to be expert in aquatic therapy?
So last spring, I obtained my aquatic therapy certification from the Aquatic Therapy Rehab Institute. And so that ensures that I understand all the standards through ATRI and qualified to provide those services. And of course, with any professional certification, it takes expertise and commitment and a passion for what you're doing to earn that certification. And this certification also requires that I have a minimum of 10 hours of continuing education within aquatics per year to maintain that. So that keeps me up to date in the aquatic field.
Terrific. Thank you for being so specialized in that field. That's terrific.
Yeah.
So what's the benefit of water therapy? You know, why would someone need that therapy?
So the properties of the water are what really make it a wonderful medium to exercise in. So the buoyancy of the water is that upward thrust that you feel when you get in the water. And that assists people to move and also helps to take some pressure off, decompress the joints that are submerged in the water. So that's what really makes it more comfortable to move in the water. And then the hydrostatic pressure of the water is that an even pressure throughout anything submerged. And again, that helps decrease swelling or edema, increases circulation. And then the viscosity or the thickness of the water is what creates that resistance when you move in the water. So we can also work a lot on strengthening by using that resistance of the water while the buoyancy is helping you to feel more comfortable moving in the water.
Wow, there's a lot to it. It's pretty amazing. So what type of patient then, what type of injury or what type of patient would most benefit from that? So what's your population look like that you serve?
So really any patient can benefit from aquatic therapy. We see a wide variety of patients at the pool. So we may see patients who are post-surgical, have had surgery, and maybe have some weight-bearing restrictions, but because, again, that buoyancy helps to take some of the gravity off, sometimes we're able to start working on things earlier in the water than they may be outside of the water. We see patients pre-surgery, so maybe working on strengthening before they go into surgery. We see patients with low back pain, neurological problems, chronic pain. Again, often it gives them an environment to exercise in that's comfortable, where maybe they haven't been able to exercise outside of the water. So really, we see a wide variety of patients.
So what makes our pool program so special versus maybe another modality of treatment? So why should folks even consider this?
So our pool program at NMC, of course, our mission is to provide exceptional care to the community, and as PTs, we are fully invested in that. And we also offer an additional advantage. We call it our walking program. So what that is, it's available to people who are current patients, and they're able to access the pool free of charge during our business hours.
Oh,
while
wow.
one of the therapists is present on site. So say you had an appointment 2 days a week, you could have access to the pool those other 3 days, which
Oh, wow,
was
that's a huge benefit.
really a huge benefit for our patients who are just looking to move more, or again, maybe recovering from surgery, and hopefully help make their progression a little bit faster.
Wow, that's a huge benefit.
Yeah,
I'm learning so much. Thank you for being here. I mean, I know you're there, but I mean, really, how extensive this program is, and the frequency and use of the pool. I mean, this is
It's
really
wonderful.
great things for our community to know.
Absolutely.
So, especially in the wintertime, I mean, the pool is just a great resource. So,
Absolutely.
that's terrific. So, what about education? I mean, I understand that you're partnering up with Northwestern Orthopedics to talk about low back pain. So talk a little bit about the education that you're doing in that realm.
Yeah, I'm really excited about this. We're coming soon. We're going to be offering a couple of education sessions. The first one will be on low back pain, and we'll be partnering with Northwestern Orthopedics and Dr. Simon Shapiro, who's our interventional pain doctor.
Okay.
Will be coming down, and he'll be speaking for the first 15 to 20 minutes about low back pain, how to know when to see a doctor, and maybe some tips for home management. And then I will speak in regard to aquatic therapy and low back pain. And then for the last 30 minutes or so of the session, we encourage participants to bring their suits and a towel, and we will get in the pool and go through a series of exercises that we recommend for patients with low back pain. And then upon completing that hour-long session, participants will receive a coupon for a discounted monthly membership at Brandon's Pool.
And that's where you're located too, just to be clear.
Yes, we are.
At Brandon's Pool. Okay.
We are. And then we will also be doing a session on hip and knee pain, partnering with one of the orthopedic providers, which will be a similar format.
That's terrific. I think the more education we can do, that's and is it going to be right at the pool, or?
Yes.
Okay.
Yeah.
Okay.
Yeah.
So bring your swimsuit, some towels.
Yeah. All that stuff.
That sounds good. Now, what about the connection with Northwestern Comprehensive Pain Management? Now, you talked about acute pain and working with Dr. Shapiro. What about the chronic pain and the work of Dr. Harrington at that program? Is there any connection there?
Yeah, we will also be partnering with Dr. Harrington and doing a session on chronic pain and fibromyalgia. And that's really exciting because we see a lot of patients at the pool who have chronic pain, and it gives them a place to exercise where they may not have been able to exercise outside of the pool. And often I will hear, wow, I could never do this outside of the water. And so it makes people feel good. So I'm excited to be able to offer that session to the community so that hopefully people will find an avenue for exercise if they're having chronic pain.
Does any individual come to mind, or just their experience about how water has really helped them and given them hope, like chronic pain or other? Is there anybody that stands out in your mind, that a story that you've impacted, or is it just generally how it makes them feel, or?
Yeah, it's generally, I don't know about a specific story, but I mean, just yesterday, someone said to me, oh, I could never do that, or it feels so good to walk in the water. I could never do this, or, if I'm walking for just a couple minutes outside the water, it hurts, but look at me in here, and I hear that on almost a daily basis. And so it's wonderful to see people be able to move in the water.
Yeah, that's tremendous. Just to hear that.
Yeah.
No, so I've heard this I Chi. What is that, and what's that therapy used for?
So I Chi is something we've started using more recently at the pool. It's a combination of coordinated deep breathing and slow, broad movements. So it's using the concepts of Tai Chi, Shiatsu, and Qigong, and it's very relaxing. So I will be touching on that during the session with Dr. Harrington, because there's actually very good research out there to support use of treatment of I Chi with patients with fibromyalgia. So we've started doing that, and again, the heat of the water helps them to relax, and the deep breathing and slow, broad movements seems to be very successful. So it's an exciting technique that we're using.
Wow, it does sound terrific. Now, you've spoken a lot about education sessions. How do folks get connected with these sessions? If they're hearing us, how do they connect?
Yeah. So they can call Sarah, who's our rehab supervisor, at 524-8427. Or, of course, when in doubt, they could call the main hospital number, ask for the Rehab Services Department, and anyone who answers could help them to sign up for these sessions.
All right, that's terrific. Now, with your aquatic therapy, because I know folks will want to know this, do they need a referral, or how do they get to you?
So yeah, they do need a referral to have PT services at NMC, and they can call our Rehab Services Department, 524-1064, and they can give you more information if you need more information, and get you set up for services.
Terrific. Now, what do you do for fun? You're helping other people relax and reduce pain and get them back to their full potential. What do you do for yourself?
Well, I'm married and I have 2 children who are 9 and 6, and so a lot of what I do is play and be active and have fun with them. I love volunteering in my son's kindergarten classroom, and I lead my daughter's Girl Scout troop, and watching them play various sports, and just trying to enjoy every minute of being active with them.
That's terrific. Thank you so much for telling the story today about aquatic therapy, because I think it's something that we don't think about. You know, you think about when you get out or you have an injury or something, you might go to your primary care provider or, orthopedic surgeon, and then you think about therapy services. Our minds go right to, using of equipment, and therapy services, and to know this is here. And so should patients actually ask for aquatic therapy, or is that a natural plan in the physician's, protocols? So are you in a protocol, or is there a connection there?
Sometimes patients might come to us with a referral specifically for aquatic therapy. Sometimes they might not, and we as therapists may determine that, we think this is a really good place for this patient to exercise. So we get patients who are referred directly to the pool, and we also see patients who may have gone for an initial evaluation at our Cobblestone office, and that therapist determines, I really think that it would be good for you to exercise in the pool, and so then they come down to us for a period of time, and often we will progress patients from the pool back to what we call land-based therapy.
Sure.
So yeah, it doesn't have to come specifically from the physician, but sometimes it does.
Sure. And do sessions last, are they usually like 6 weeks, or is there a standard?
It really varies. I will say generally we see people about a month or so, 4 to 6 weeks maybe at the pool, depending on what they're there for, how well they're doing. And then we progress them usually one of 2 ways, either to land if they're looking to do more strengthening, or again, we do offer, Brandon's offers that discounted monthly membership to people who have been patients as well. So some people choose that avenue, and just to continue with exercising in the pool.
Terrific. This has been very informative. Thank you so much for joining us today.
Thank you very much.
Yeah. This is Jill Bowen, CEO of Northwestern Medical Center, and your host today. And I really think you should check out this aquatic therapy. When I think about pain management and relief of pain, if you haven't found that, this may be an answer for you. So give us a call at Northwestern Medical Center and ask for the rehabilitation services. They'll get you connected. Thank you.